What you're observing today is a full-scale exercise at a hospital following a mass casualty tornado hit to the south of the hospital. It's hit a care center. The care center has a number of dementia patients and other residents. They will be coming into the facility here with a variety of injuries and challenges for the hospital staff.
The following is a set of goals for the mass casualty exercise. Goal: test Memorandum of Understanding and Memorandum of Agreement. GRMC staff will execute an MOU or MOA with County Emergency Management for placement of patients needing non-medical shelter. Goal: temporary morgue setup. Designated GRMC staff will demonstrate the ability to establish a temporary morgue to meet the demands of an incidence of multiple in-house deaths. Goal: interoperable communications. GRMC staff will utilize Cisco wireless phones to communicate internally during an emergency event. Goal: use of volunteer professionals. Designated GRMC leadership will receive and respond appropriately to text message alerts regarding a disaster event. Department leadership will utilize call-down protocols to ascertain the number of staff available to respond to an emergency at GRMC. Goal: bed tracking and shelter in place. GRMC staff will use the ED patient tracker to move patients and medically sheltered through bed management process during a shelter-in-place order.
Today we had a disaster drill exercise that we had with 25 patients coming into our emergency department. We worked with the Burlington Fire Department and had them staged and triaged through our emergency department. We had them categorized as red, yellows, and greens.
Priority 1, red. Serious but salvageable life-threatening injury or illness. Victims with life-threatening injuries or illness, such as head injuries, severe burns, severe bleeding, heart attack, breathing impaired, internal injuries, are assigned a Priority 1 or red triage tag code, meaning first priority for treatment and transportation. Priority 2, yellow, moderate to serious injury or illness, not immediately life-threatening. Victims with potentially serious but not immediately life-threatening injuries, such as fractures, are assigned a Priority 2 or yellow, meaning second priority for treatment and transportation triage tag code. Priority 3, green, the walking wounded. Victims who are not seriously injured are quickly triaged as walking wounded, and a Priority 3 or green classification, meaning delayed treatment and transportation. Generally, the walking wounded are escorted to a staging area out of the hot zone to await delayed evaluation and transportation.
First one in the red.
Yellow is supposed to be going out front.
Of the patients coming through the system, we tested several things. First off was our electronic patient tracker.
And they transferred
About 7. When we get their name, we have their names. You can see the John Does that we don't have the names, so we make those John Doe 1, 2, 3. We have their ages in there, pink for female, blue for male. And if they're a green patient, it will say green disaster, red disaster, yellow disaster, what their stated complaint is, and then where they're located at in our facility. So these patients are still out in the waiting room. These patients have been from the waiting room up to day surgery. This one has gone to the morgue. These two have gone to the OR. This one remains in the ER. And then these 3 also have gone to same day surgery.
The second thing that we tested had to do with how we would handle multiple air helicopter evacuations. We also tested the triage flow of patients through the emergency department, since we just remodeled our emergency room and the floor plan is a little bit different than we've had in the past.
The patient is brought in and entered into the electronic patient tracker according to the patient's triage tag code, then directed to the proper station corresponding with the triage tag code.
A11.
Yellow is coming in the back. Yellow's supposed to be coming in the front.
Yellow is going to stop at that first station.
At the next station, the electronic patient tracker is checked for any changes in patient status. The patient is then directed to the proper care unit according to their status.
Okay. Am I supposed to take her somewhere?
Nope, she.
You have to have 3 people first.
Oh, okay.
Yellow or green, Kathy?
Yellow. How are you?
The other thing that we tested was our MOU with the blood bank and talked to them about having the need for critical blood supply. We worked with Sunnybrook Assisted Living Facility to have someone from their facility come to identify patients who couldn't speak for themselves or had medical conditions or dementia to make sure we had accurate patient information.
Yellow, I think. Yellow, combative patient.
Yellow needs to go out front, out through triage.
I hope she doesn't jump off the cot first. She's giving us a hard time.
I want my mom.
The other thing that we worked on was identification of patients with hospice and if that communication would flow through to our hospice house. And then lastly, we had some patients who had been tracked in the system moving out of the emergency department to a secondary triage area for treatment, and at that point in time they took a turn for the worse and became a black patient and were transferred to the morgue.
She is now changed to a black, so
You have to go all the way
on her
through
tag.
PR and out the back.
instead of a red, which is fatal. So.
Well, actually, yeah, go through Arlene, so we're not really going to do that.
And all of this information then flowed through to our incident command, so they had real-time feeds of patient movements throughout the organization.